I am Melissa Webb, and my project for this summer for the COLL300 class, Merging Research in Action, is me working in a pharmacy at Lackey Free Health Clinic and working at a pharmacy in Rite Aid. So the reason why I chose the pharmacy, first because I have been volunteering at Lackey, the Free Health Clinic, for about a year now, and I thought that it would be a great way to be able to tie it in with this class, and so that's why I chose the pharmacy. I also was given the opportunity to work at Rite Aid as a pharmacy technician, and so I thought I could tie that in as well, and I believe that these two I could compare and contrast them and see similarities and differences between them. Between a free health clinic pharmacy and a chain pharmacy. I've definitely seen some similarities and differences, and I will plan to explain that later on in the presentation. So two theories that really resonated with me while I worked over the summer was cultural humility and John Dewey's fully action-based approach to learning and research. For cultural humility, this really helped with and recognizing cultural borders and differences between me and patients, among me and patients, especially at Lackey and Rite Aid. There may be many customers, especially at Lackey, whose first language is not English, and therefore we may have a language barrier, but I constantly remind myself to be humble and not see myself as superior to them, recognizing them, of course, but not seeing it as an issue or something that I should use to make myself feel more powerful over them. In terms of John Dewey's fully action-based approach, I really think this helped with why I fully immerse myself in these situations. It really helped me learn about the pharmacy, especially chain pharmacies, because instead of just researching it online, I was able to fully immerse myself and learn firsthand experience of what a pharmacy is like, especially Rite Aid pharmacies, as chain pharmacies are very popular around the country. So the community that Lackey serves is Yorktown, Virginia, and surrounding counties such as James City County, Williamsburg, and Poquoson. These areas are served by Lackey. I think Lackey serves about 1,500 patients. It has served about 1,500 patients over its 20 years of existence. While this is not a huge percentage, I think it's about 0.1% of the population, of the surrounding population, they still do a great service to their community. Lackey, as the slide says, can serve to people that live at or below 200% of the poverty level, and they also only serve those who do not have any sort of insurance. I think we're going to start eventually accepting Medicaid, but for the most part, at least right now, we only serve people that don't have any insurance. The common transportation way for people to get around is either driving themselves via automobile or the WTA transportation system. And the area around Lackey is very rural. In contrast, Rite Aid, specifically the Rite Aid that I work at in the Deep Creek area of Chesapeake, serves hundreds of patients every week. The Chesapeake is about 3 times the size of York County, which is where Lackey is located. Rite Aid is also located in a very suburban area of Deep Creek, therefore it's not very rural. However, it is right next to the Great Dismal Swamp. The most common transportation that I've seen with patients is via automobile. And so in terms of the importance of Rite Aid and chain pharmacies, one important point is the fact that 9 out of 10 Americans live within 5 miles of a chain pharmacy, and in cities this radius is even smaller at a 1.83 mile radius. Therefore, these chain pharmacies are very convenient for individuals, but also they provide a great service to Americans. Rite Aid also specifically does things to make sure their patients' health are insured. For example, they allow for patients to be able to sign up for a Rite Aid savings card. Perhaps they may not have insurance and they can use this savings card to save money on the prescriptions since they don't have insurance to cover it. The importance of Lackey and other free health clinics is the fact that they help reduce healthcare costs, and they also invest in preventative and primary care. One thing of how they help reduce healthcare costs is the fact that instead of having a patient who doesn't have any insurance go to emergency room and therefore having a bill that may be thousands of dollars, or going to an urgent care clinic that may have a bill between $50 and $150, they instead can go to Lackey, which, for example, only charges a patient a $10 fee to see a doctor, and then between $4 and $10, or even free, depending on how much the prescription is. Depending on which prescription it is, for example, a $4 prescription is a 30-day supply, a $10 prescription is a 90-day supply, and then we also stock free prescriptions that are given through a program called Direct Relief or RX Partnership, which allow for patients to get prescriptions for free. These free prescriptions include Chantix, which is a smoking cessation product. Other free medications include such as Janumet or Januvia, which is diabetes medication. I also think that the fact that these prices are fixed and they do not change, I think really allows to gain trust by the patients, as consistency is a huge way to gain trust from people. And therefore, I think Lackey and other free health clinics are doing a great job at this, especially, as I said, investing in primary and preventative medicine, which can help in the long run and also help reduce healthcare costs. So one of the biggest problems that I recognize with the pharmacy, especially in terms of Rite Aid, is this summer has been the first time I've been able to work there, is the fact of what they're doing to combat the opioid epidemic. One specific thing that Rite Aid does is the availability of a naloxone prescription, which help reduce the side effects of a opioid overdose. I personally have seen a couple of these being prescribed, so I think that they're definitely doing a great service to patients. Also, what Rite Aid and I'm pretty sure all chain pharmacies have to do in the state of Virginia is register patients on the prescription drug monitoring programs, or PDMPs, which help regulate and monitor controlled substances to make sure that they are not being abused by patients. Also, there is restrictions on filling controlled substance medications, specifically C2 medications, which include your oxycodones, your Percocets, your Norcos. These restrictions are where you cannot fill any of these prescriptions up to 2 days in advance. You can fill them up to 2 days in advance, but if someone tries to fill them on perhaps if they should have 3 days left, we can't do it. We also cannot fill them if they do not have a new prescription. These controlled substances do not have any refills on them when the prescription is given, so that means that they will have to bring in a new prescription every time they need the prescription. Insurance may also not cover a prescription if someone is trying to fill it more than 2 days in advance in terms of opioid medications. At Lackey, however, they do not provide any sort of controlled medications, so the opioid epidemic problem that I saw coming in does not apply to Lackey. However, it definitely applies to Rite Aid and other huge chain pharmacies that do provide these medications. So, my role at these two pharmacies is a pharmacy technician. This relationship between a pharmacy technician and a pharmacist has often been described as a relationship between a nurse and a doctor. We as pharmacy technicians have increased our responsibilities over the past 20 years. We used to not be able to do as much as we can do now, but basically we can do nearly as much as the pharmacist does. My initial goal at Lackey was to see if prescriptions filled at Lackey had trends that were similar nationwide, and what I found is that it actually does. The most common medications to be prescribed are diabetes medications at Lackey, such as your metformins or your Januvias or your spironolactones, and this is a very similar trend that has been observed in America. Also, in terms of Rite Aid, my initial goal there was to just learn and understand how a community chain pharmacy works. As I have said, these type of chain pharmacies are the most popular and most convenient and most used by America, and so I thought that being able to fully immerse myself in this experience will give me a lot of research and a lot of knowledge about how a pharmacy actually works. As I said, Lackey only serves maybe 100 patients every week, whereas Rite Aid serves hundreds of patients every week. Therefore, I think Rite Aid really gave me a lot of knowledge about how a pharmacy actually works. Also, what I wanted to learn about was how Rite Aid and other chain pharmacies help combat the opioid epidemic and what specifically I can do. What I found is that I could help with perhaps opioid counseling. If I am talking to a patient about how they manage their pain, what I researched is instead of asking them to rate it on a scale of 1 to 10, I instead asked them to ask how functional they are and how able they are to go about their daily business with their pain. Also, through my research, I found that I should view pain as not just a symptom, but instead of it as an actual disease itself. I think this really is profound and a sobering statement that I found in my research, and I think that it'll definitely help me see it as something that should be eradicated instead of something that just needs to be controlled. All in all, pharmacies really help keep the health of this nation in check. It really, specifically chain pharmacies that are used by millions of Americans every year, really help maintain this. Free health clinics also give patients that don't have any insurance or do not have any money, who may be near, at, or below the poverty line, be able to also stay healthy. I've definitely learned a lot about chain pharmacies through this summer, and I definitely had a fully immersive experience.